Thank you, Madam Speaker. The bill before us is bipartisan, it's bicameral, it guarantees health care to more than 1 million Oregonians, and it has broad support from all of the stakeholders. If there was a better way to do this, our work group was all ears. The stakeholders were all ears. And I agree, we need more accountability in the Oregon Health Authority. And this is something that we're working on in our underlying budget bill. But we can pursue accountability at the same time that we guarantee health care for more than 1 million Oregonians for 2 years. And that is an important fact. That certainty is extremely important in a time like this when the federal government, where there is so much uncertainty. These are some of the most vital benefits that people have when they're trying to pursue this. It is an intimate benefit, and we need to guarantee that benefit for the years to come. I absolutely respect the work that has been done by my colleagues that oppose this bill. They didn't sit back and just cast a no vote. They tried to come up with a plan, an alternative. But unfortunately, that alternative does not work. And it doesn't work for a couple of reasons. First of all, the numbers don't add up. And as you heard Representative Parrish, by her estimate, it's about $85 million. If you look at the numbers, some of the money was actually double counted and raises up to about $135 million. And when some of the colleagues have talked about the burden on K through 12, the burden on higher education, from a budget perspective, when this budget is short, $85 million, that means in Ways and Means, we have to find that money elsewhere. Where are we going to take that money, Madam Speaker? Are we going to take it from education? Are we going to take it from higher ed? Where is that money going to come from? And as sitting on Ways and Means, one of the things that I've continually heard over and over again as people vote no on bills is they want more money in these other bills. Where is this money going to come from, Madam Speaker? And how are we going to guarantee all of these essential benefits, the vision for Oregon that we all share? How are we going to do this if we don't pass this package? Number two, the alternative plan does not have broad stakeholder support. In fact, it doesn't have support from the stakeholders that were involved in this process, but it also didn't have support in our committee, our subcommittee. The good Republican co-chair, vice co-chair of the full Ways and Means, Senator Jackie Winters, indicated that she was not supportive of several elements of this alternative plan. We couldn't even have gotten this out of our subcommittee had we wanted to. Moreover, the arguments against the 1.5% assessment, quite frankly, they don't hold water. They don't hold water because the numbers don't work, and they don't hold water because of our personal experience with similar programs. And I want to talk about that a little bit. Representative Noce did a wonderful job illustrating the numbers, but really specifically from DCBS, the actual numbers, okay, of the increases. On the small groups, it's $6.59 per month in increase. For the large group, it's $6.75 per month. But what we keep forgetting about in this conversation, we talk about this impact, but we don't look at the global impact, the impact of the vulnerable individuals that can't afford health insurance premiums and that need the stabilization of our private individual market. And that is critical. We have to provide them subsidies so that they can. And this market is not stable. And if we do not do this in this plan, we will have bad results. We've already been working on trying to stabilize that market. The personal experience to indicate that this is a plan and we've been worked in the past is 2009, Madam Speaker. In fact, actually, you sat at this desk, Madam Speaker. I was looking at the brass plaques on the side of this, and you sat here and you pressed your green button for the Healthy Kids bill. You pressed that for a 1% premium tax, and that provided health insurance to kids across Oregon. And you know what, Madam Speaker? The sky didn't fall. But you know what did happen, Madam Speaker? Children across Oregon got health care. And I would have been proud to have sat anywhere in this chamber and have voted for that bill. And I'm proud today to support this bill as well. Thank you, Madam Speaker.